My name is Laura Anderson. I'm a current PGY3 in emergency medicine at Mount Sinai. The title of my presentation is Evaluation of an EMS Protocol to Identify Low Acuity Patients Appropriate for Urgent Care. I have no financial disclosure or conflicts of interest. So it's estimated that 15% of patients transported by EMS can be safely managed at an alternate destination, such as an urgent care center. Despite this, the standard of care remains that when you call 911, you get transported to an emergency room. The ET3 program, or the Emergency Triage, Treat, and Transport program by CMS, has prompted EMS systems to develop protocols to safely identify patients appropriate for either treatment in place or transport to an alternative destination, such as an urgent care center. So the purpose of this study is to examine whether a recently developed New York City EMS protocol can safely identify patients who would be appropriate for treatment at an urgent care center. This was a retrospective cohort analysis of low acuity ED patients, so defined by an ESI score of 4 or 5, all who arrived by 911 EMS ambulances. So the cases were identified using electronic medical record at an academic medical center. And then the EMS records were reviewed to determine whether the patients met the inclusion-exclusion criteria of the protocol. And for those people who met the inclusion and exclusion criteria, those charts were then reviewed by blinded urgent care physicians to determine if they were appropriate for urgent care or if they would send them to an emergency department for further treatment. So here we have just listed some examples of the inclusion criteria, such as asymptomatic hypertension, a rash without respiratory distress or fever, minor wounds, lacerations, suture staple removal, and medication refills. Some exclusion criteria include those who are pregnant, immunosuppressed, those who had a surgery within the last 3 months, anyone with an abnormal vital sign, including blood glucose less than 60, greater than 300, and then certain chief complaints such as abdominal pain, chest pain, seizure. So for our results, we had 279 patients who were brought in by 911 EMS, all who were low acuity. Of those 279, we had data available for 258. Of the 258, 75 met the New York City alternative destination protocol. And then of those 75, 72 were thought to be appropriate for urgent care. So I just want to briefly review the patients who were not appropriate for urgent care. There were 3 of them. The first was a 61-year-old male diabetes CKD CHF who had a motor vehicle accident where he was a restrained front passenger, came in with right knee pain. He had no head trauma, was ambulatory. A fracture was not suspected. He did not have any x-ray imaging and was given return precautions, discharged home. The second was a 44-year-old male past medical of hypertension, diabetes CHF. He came in hypertensive 190 over 80 with EMS, 190 over 100 at the ED, had recently lost his insurance, was not taking his medications. He was asymptomatic. He was provided social work and a refill of his antihypertensive medications and discharged home. And the third was an 84-year-old male with a past medical history of bullous pemphigoid, was hospitalized 4 years ago for that. He came in with a rash for 10 days and he required a dermatology consult and was admitted for IVIG and rituximab. So for our results, this is our 2x2 table showing our true positive, false negatives, and true negatives, giving us a sensitivity of 41%, a specificity of 96%, positive predictive value of 96%, and a negative predictive value of 44%. So in conclusion, we have a very high positive predictive value. Approximately 96% of the patients identified by the New York City Alternative Destination Protocol could have been effectively managed at an urgent care center. Actual safe implementation of this will depend on training. EMT utilization of and compliance with the protocol needs to be further evaluated, and further prospective validation of the protocol is definitely needed. So if you have any questions, or comments, you can contact me at lara.anderson@mountsinai.org. And then I've also just included an appendix of our inclusion criteria if you'd like to review. And also the next slide is our exclusion criteria. So thank you so much.